కమింగ్ బ్యాక్ టు రీప్రొడక్టివ్ హెల్త్ డాక్టర్ గారు, మెనోపాజ్ ఒక ఇష్యూ. కానీ ఇండియాలో మెనోపాజ్ అంటే అదొక దానికి ఒక ట్రీట్మెంట్ లేకపోతే డాక్టర్ దగ్గరికి వెళ్ళాల్సిన అవసరం ఉందంటారా ఆ టైంలో?
The answer is yes. If you look at when I was studying my first year of medicine in the 80s, there the average life expectancy was 50 years. Hardly post-menopause 5 years survival rate. Akkada the role of hormone replacement therapy did not exist. By the time I came into finished my post-graduation and I attended the World Congress at Singapore, in 91 FIGO, and the Federation of International Obstetrics and Gynecology Conference, it is held in one continent every 4 years. So I attended that conference in Singapore. At the time, there was a lot of emphasis of hormone replacement therapy because women were living longer, and in the process they are suffering with hot flushes short term. In the long term, they are having cardiovascular deaths and fractures, which are consequence of absence of estrogen. So to prevent that, hormone replacement therapy has come in.
డాక్టర్ గారు, ఇప్పుడు మీరు ఫ్రాక్చర్స్ అన్నారు కదా, అంటే మెనోపాజ్లో బోన్ డెన్సిటీ
తగ్గిన సో ది హార్మోన్ రిప్లేస్మెంట్ 90sలో నుంచి లాట్ ఆఫ్ ఎంఫసిస్ వచ్చింది. దెన్ సబ్సిక్వెంట్లీ బై late 90s, closer to 2000, then they realized some amount of progesterone should be given to prevent overaction of these estrogens.
Okay.
So the exact dose finding for menopause took a decade or decade and a half. So in the process, lot of misconceptions are crept in.